Now, there's a common question that we get a lot, and it is it two different procedures to take out the breast tissue and to take out the gland? Now, this is something that I have seen way too many questions about, where people will ask me, well, what did you have taken out? Was it just the breast tissue, or was there a gland that he took out? Can you clarify what they might be talking about? Is that true or false, and what's going on there?
Well, for me, as I say, I've done a lot of them, and what I do is I go in there and I remove tissue, which is white in nature. It becomes very clear. I make my incision right under the nipple with the half moon, and when I lift that up, there is a little ball in there of white tissue, which is very descript, and I remove all of it. And it's usually breast tissue with some cystic tissue, and I think what it actually is doesn't really matter that much, but it's a ball of white tissue, and it's very clear where it is, and you remove that circularly. Then I go in with my finger, because I can usually get in there, and I feel. So for me, it's a hard mass that I can feel that I remove by palpation, and when I'm done, the firmness is completely removed. Surrounding it, you see normal breast tissue, normal fatty tissue, which I leave. If the removal creates a little sunken area under there, I'll usually feather with a little bit of liposuction just to get everything real smooth so we don't create a little crater underneath there. So maybe a fine amount of fine tuning, but I believe it's just some glandular breast tissue, which is probably hypertrophied due to uses of various agents or other things. I don't know, anyone knows exactly which ones would cause it. That's usually what I see, and I remove it. And the mass is usually quite palpable and usually tender, and when I remove it, the pain is relieved and the mass is gone.